Good evening, ladies and gentlemen. This is the Truckers Podcast. I'm your host, Doug, from Ontario, Canada. Welcome to the show. It is 10:22 p.m. here on the 8th of January. Thank you for joining me. And we'll talk about a couple things out here tonight. One, starting with the list of symptoms that require students to stay home, well, once they get back into class. Thank you for joining me. Thank you for joining me out here tonight, ladies and gentlemen. I haven't been out here for a couple of days, I guess 4 days now, but here we are Saturday night, and yeah, I'll start off with this. This past week, I've been at home. Came in contact with somebody who has COVID. So, I did my isolation, 5 day isolation, but I've had this stubborn cough, scratchy throat, runny nose, congestion, a little bit of body aches. Had a PCR test done yesterday, haven't got my results back yet. So hopefully I don't have COVID. So I have to just wait to see. Now, with the schools being out for as long as they have been, since a week before Christmas, and then being extended until the 17th of this month. And they've done this before, the school boards here in Ontario, that they're adding new COVID-19 symptoms to the list that require students to stay home. Now, like I said, they've done this before, so under the previous policy, children were only required to isolate if they had one of the 5 symptoms that were commonly associated with COVID: a fever or chills, shortness of breath or a loss of taste or smell, nausea, vomiting, diarrhea, or a continuous cough. So the new guidelines, which was quietly updated on Thursday, just passed 2 days ago, adds 5 additional symptoms to the list and requires that the siblings of symptomatic children also isolate at home, even if they are not. How you doing? Thank you for joining me. I'm your host, Doug, from Ontario, Canada. So the list of symptoms that are going to require students to stay home, and like I said, they've done this before when school has been put back up to online learning here across the province of Ontario. Now, under the updated, like basically what they did this actually quietly on Thursday, just passed, and so if you have siblings that go to the same school, and one of them, just out of the blue starts coughing in the classroom, both kids will be sent home, and they'll have to isolate at home. Doesn't matter if they got a runny nose, sneeze, or whatever. They're going to be sent home. That's if and when school starts back up January the 17th. We have parent groups out there. We have, pediatricians out there calling on the government to make sure if the schools are going to reopen on the 17th of January, that they get all these safety protocols in place. And we've seen this time and time again throughout this entire, for simply a cough. If the child is in the classroom and they start to cough, the child will be sent home. And if they have a brother or sister in the same school, they'll be sent home as well. They've done this before throughout through this pandemic, when they've opened the schools and closed the schools, opened the schools and closed the schools. And every time they've closed the schools, the government says, "Yeah, it's going to be better when we open it up. It's going to be safer for the kids." And lo and behold, we shut the schools down again. So we have parent groups out there, pediatricians out there calling on the government. If the schools are going to open on the 17th, then we got to have better safety measures in place. And right now, the government is making it possible that teachers will be supplied with the N95 masks. School bus drivers will be supplied with the N95 mask. And of course, updating the air system, ventilation system throughout the schools in hopes that can get back to opening again. Because, I mean, when you have, and I've heard this from parents. I mean, I'm a parent myself. I have grandchildren. They're doing online learning. And I see the struggles firsthand. So if if you have two parents at home working from home, I mean, obviously, throughout your daily routines, you share the parenting responsibilities. Yes, you both have a job to do. Yes, your kids have to be online learning. Yes, the employer, they have to work with you as well. A single parent, well, I mean, that's hard because, um, businesses are still open. Most businesses are. I mean, like gyms are closed, movie theaters are closed, um, things are set back to 50%, indoor dining is closed, that sort of thing. But even for a single parent, I mean, if you're working in, any other field that's not closed, I mean, now you have to stay home so your kids can do online learning. This throws a wrench into a lot of people. The government, they've always said time and time again, and throughout this pandemic, that schools are going to be the first to open and last to close. Well, the schools weren't the first to open. They've been out of school since a week before Christmas. They talked about opening the schools back up on January the 1st, or not or January the 5th. And then other provinces here in Canada, they were extending their school closures. And Ontario, almost being one of the last, decided, okay, maybe this might just be a good idea. We're going to come out just 2 days before school goes back in, and now we're going to extend it to the 17th. I think Alberta is the only province right now that has their kids in school, but what they're seeing is a shortage of staff because they're coming down with COVID. They may have to resort back to online learning. Yeah, so even the simplest symptoms, like I said, if a child is sitting there in class coughing, they're going to be sent home. And that's got to be really tough on the single parent too, because the single parent's at work and now they got to leave work to get their kids and take them home, and they have to isolate. I don't, honest to God, people, our government here in Ontario, the Ontario government, you know, through the 2 years that we've been going through this, they've never gotten it right, not once. What happens? I mean, when it goes with why are our homeowners still paying the same school taxes? Well, I don't really. I mean, they have to. I mean, you pay the school taxes to, it helps fund the schools, right? So they gotta pay the school taxes whether the kids are in class or not. So that's the way it goes. I mean, when you hear how it works here in Ontario, anyways, is that when you own a home and you're paying property taxes, they ask you if you want to support the public school system or the Catholic system. So it comes out of your taxes, right, out of your property tax. So yeah, I mean, we're not going to stop paying school taxes because the kids are out of class. I mean, the funding still has to go forward. So I mean, it's not like the kid's going to be out of school for the rest of their lives. At some point in time, they're going to be going back to school. But the government here in Ontario, I mean, they've gotten it wrong every single time. And I can understand the frustration from parents, and I can understand the frustration from the teachers, um, from the teacher unions. I can understand their frustrations. When the government stands up, Premier Doug Ford stands up, or the health minister stands up behind the microphone and is saying, yeah, or even the educational minister, oh yeah, things are going to be better, and it's going to be safe when the kids go back to school, and this thing and the next, and they've done this throughout the whole entire pandemic, and here we are again. They just sound like a broken record. They sound like a broken record. Now, the government of Ontario right now, what they're going to do is that they are going to, let me pull this up for a second here. Oh, that was pretty fast. Let's see where it went here. Oh, here we go here. Yeah, so now Ontario, the government of Ontario will set aside vaccination appointments for education and childcare workers to get vaccinated. The Ontario government will give education and childcare workers priority access to vaccination appointments following criticism that they were not doing enough to support the safe return to school later this month. Now, wait a second. People here in Ontario has had ample time to get vaccinated. How are you doing this evening? They've had ample time. to get vaccinated. So now we're going to set aside more time for
Uh,
people to
Hi,
get vaccinated.
Trucker.
Hey, how are you?
I'm good. Hello, Canada.
And this is hello back.
How you doing, Trucker?
I'm doing good. How's things on your end?
Same. It's also good. It's a morning here. Just we are making some plans.
Morning time. What time in the morning is it?
Yes, it's 7, 9 a.m. in the morning.
Oh, 9 a.m. in the morning. It's 10:40 p.m. here in Ontario, Canada.
Oh, it's a night time, right?
It's nighttime. Yeah. So, um,
How how how's the weather in Canada? Like it's snowing again.
here we had uh, snow on and off. We had a little bit of freezing rain this evening,
Mm-hmm.
but other than that, it hasn't been here in Ontario. Hasn't been too bad. The western provinces has been in a deep freeze for the
Uh-huh.
last couple weeks. You know, some places seeing temperatures 30 below, 40 below.
Uh-huh. How you
You know,
tolerating that
depending.
temperature? No, Indian we
Well,
can't
I
tolerate
mean,
like
we're Canadians. That's how we handle it
you handle it, but we
every
can't tolerate.
winter.
See here, minimum 17 degrees, we can't tolerate that windy. But how you managing
Mhm.
the temperature is very like minus 20, minus 30 will be there. The temperature will be fall down it's like a iceberg, right,
Freeze your
Raga?
eyes closed.
Ah, if we'll
Yeah,
be
so I'm
there in
just
your country. If we'll be there in
yeah.
your country, just we'll get die easily in this situation. We can't tolerate this weather.
You would come accustomed to it. We have lots of people, come from all over the world, whether they come from warm climates
Yes,
and
yes,
they come here,
yes.
or they move to the United
I
States
think
or whatever like that too.
I think most of the
So
Indians are in Canada, right? Like Punjabis.
yeah, oh yeah, oh yeah, yeah, yep, all across the
Uh,
country.
Yes,
Yeah.
but
So
I never message.
yeah. So
But
um, the kids are they
mm,
going to school right now?
uh, the government given a holidays there. Why? Because in India we do have festival like Pongal and Sankranti. January it's 14 from 14 to 20. They make a holiday here. The government declared the
Oh,
holiday
okay.
for 10 days.
Oh, okay. Okay. Yeah, we're just here across Canada here. Schools are closed until at least the 17th of January because of COVID. Um,
Uh-huh.
and not only that, I mean, businesses are starting to become short of staff.
Mm.
Because people are coming down with COVID. Whether it's
Yes.
in the manufacturing or whether it's in uh, food services, wherever we're just even in the hospitals, police, fire, ambulance, we're facing a lot of shortages.
In India, in a single day, 2 millions vaccination, the drive is gone. 15 to 18 years age, the people get vaccinated. Only 2 million people, only for a single day.
In a single day, 2 million people got vaccinated.
Yes.
Yeah, yeah, we're I don't know. We're all over the place. We're bouncing all over the place. And right now, the Ontario government is setting aside appointments for uh, educational workers and childcare staff. Um, the thing is that they have had ample time. They've had ample time to get vaccinated. They had ample time to get the booster. We have a leader of the Conservative Party calling on the government
Hmm.
to accommodate the unvaccinated people. And we've accommodated them enough. As far as I'm concerned, we have accommodated them enough. For the
Yes.
people who have been hesitant to get vaccinated, you have had plenty of time to make up your mind, talk to a healthcare professional, and either get the vaccine or not. And then you have the anti-vaxxers are just simply not going to do it. So there's no point of accommodating them because they're just not going to get vaccinated anyhow. So we've done enough, and now the federal government here in Canada is talking about it that we might even mandate it, meaning that we'll make it law.
Of course. In some countries, like
You know.
French country, like his president Macron,
Mm-hmm.
Emmanuel Macron, he is doing some trolls. Like if you don't vaccinated, unvaccinated people, I will spit on the faces. I will kick on the app. He is mentioned the comment. The comment is going with trolling.
Mm-hmm.
Do you have do you heard about the news that just I received the news 2 days back. Yes, I seen a news in CNN channel.
Mm-hmm. Yeah, I mean, we won't like here, like the federal government here is not going to, make it law that everybody gets vaccinated, but they're putting that message out, right? So, like the other day, I think they said, oh, we're reporting, something like 20,000 cases here in Ontario. We can't even keep up with the testing.
Hmm.
So you can double that amount or you can triple that amount. That's how many cases are out there because we can't test everybody.
Yes.
And the only people that they're testing is people that work in the medical field, nursing home,
Hmm.
retirement home, essential caregivers. We're testing the most vulnerable.
Yes, it's a
We
horrible.
can't for the rest of the population, you can't even book a PCR test unless you fall under one of the categories that you are able to get a PCR test.
Hmm. What's the
Right?
cost
So
of?
they can't even do that.
How much the cost in PCR test in Canada? What the price
It's
is?
free. It's free.
It's
If you,
free.
it's free. They're
Uh,
even sending out the rapid test kits. They're all free.
but in India they are
Vaccines are
charging
free.
money. But in India they
Yeah,
are
they're
charging
not.
money PCR test. For PTR,
Yeah,
PCR test, they are making some charges
are
in
they?
India. Like
No, we're not charging any.
uh,
No, we're not
like
charging
uh,
anybody to do anything. Like I said, if you work in the medical field or
hmm.
you're essential caregiver or you know, police officers, fire, ambulance attendants, or they all can get a PCR test. It's just
I
that
think
this variant is spreading so fast is we just can't keep up with the testing,
yes, of course.
right?
The
So they
scientists
can
are
say we
saying,
got 20,000 cases, but we have more than that,
uh,
right? I mean, we got something like over 1,200 to 1,300 people in hospitals. We got over 500 people in ICU units.
uh,
You
that's
know,
very terrible.
so that's the numbers that we need to go off of. We don't need to go off of the general population of just guessing how many cases are out there. We need to go off people who are being admitted to the hospital and people in the ICU. Those are the numbers that we need to be going off
Hmm.
from, and then the government can make decide what they're going to do, if they're going to mandate any more restrictions, or as the hospitalizations decrease and the ICU decrease, then we can start changing the restrictions and maybe opening up again, that sort of thing. But that's the only things that we really need to know. We don't need to know how many cases we get out there because that is just irrelevant. It means nothing. It's not like we
Hmm.
have 20,000 people in hospitals or 40,000 people in a hospital. That's not the case.
Yes, of course. I think
right?
in United Kingdom, yes, I got a news that 150,000 people are affected with COVID. They have been hospitalized. In Within 2 days back, they mentioned that 150,000 people are affected with COVID. It's very terrible.
We're seeing infants, babies
Yes.
coming into the hospitals testing positive for COVID.
Hmm. It's a very disgusting this COVID. How the COVID has came, we don't know. Due to China, I think that China has started that the coronavirus.
Well, everybody knows, like from the onset, everybody knows that that's where it originated, right?
Yes,
So,
originated.
but this, South Africa, this Omicron come out of South Africa. Now they got
Yeah.
another concern. Now they got another concern of another variant coming out of France.
Ah.
And we've
This should be
already tested 5 people for that other variant coming out of France here in Canada.
Yes, of course. The government should be take high security while the travelers are coming to other states. Like they should maintain some travel ban. The peoples are suffering like that. Why? Because so many peoples in my state. There, one of the people have came from South Africa. He tested that he's Omicron positive. That he recently tested. While travelers also they are spreading easily. While
And I don't know why it's spreading so easily. It is spreading so easily. Look, at the beginning of my show, um, so let's see. So I was off on the 31st because we had the day off, and I was to come back on last Monday,
yes, of course.
I'm in a household with 2 other people, and one of them tests positive for COVID. So that means now I had to isolate for 5 days. So
Oh.
yesterday would have been 5 days. So
Mm-hmm.
my nephew who lives here, he tested positive on Thursday, right? I've have I have like 5 symptoms.
What are the symptoms?
I have a sore throat, I have a cough, runny nose, I'm congested,
Mm-hmm.
and I have
Uh-huh.
aches. So 4. So I got 4. So I got 4, like 4 symptoms that that we kind of would feel like it would be just like a bad common cold, you know.
Uh-huh.
But being that I'm an essential caregiver, I was eligible to get a PCR test. So I
Mm.
had that done yesterday,
Mhm.
and I'm waiting for the results to come back, and I hopefully find out tomorrow. Like my throat
Mhm.
is still sore. My throat is like it's freaking raw. I want to
Mhm.
sit here and cough, but I'm doing the show, and I want to cough, but I don't want to cough while I'm doing my show,
So you are a
right?
wonderful person.
So I got a little. Excuse me, I got a little bit of water to drink too to kind of keep my 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 throat wet. But it's hard not to cough. I'm telling you right now, it really is. I'm really trying to hold it back. So,
You are
but
wonderful.
anyways,
You are a
hopefully,
wonderful person.
hopefully I
You.
don't have it. My other nephew and his wife got COVID.
Mm.
So, and 2 people in the household that I live with tested positive. So
Ah.
chances are, excuse me, chances are I have COVID,
Oh. Present,
and
how is your health? Okay.
I'm
How
fully
is your health?
vaccinated. My health is good. I mean, I'm fully vaccinated. I have the
Mm.
booster. I'm 58. You know,
Bah.
excuse me. So I didn't want to do that. So yeah. But it doesn't matter, right? I mean, how can you avoid it if 2 people in the household test positive?
Mm.
It's going to be kind of hard to avoid. I mean, I would be shocked if my test results come
Yes.
back negative.
Yes. I
But
think you will get a negative.
I've been,
Just,
yeah. I mean, I've been off work since the 31st, but I didn't expect to be off this week, and I didn't expect anybody here in the house to test positive, and we're all fully vaccinated. But that doesn't
you're
matter.
fully vaccinated. Are
Yeah,
you
I'm fully
you are
vaccinated.
but how the COVID
Yeah,
is coming from again back? I don't know that. How it is spreading easily. If you are vaccinated also, how the COVID coming back and attacking again?
yeah. I don't know. This variant here is easily spread. So it doesn't matter. I mean, people say, people say or think, that, oh, I get vaccinated, I won't get COVID. Yeah, you will get COVID, just like the flu
Yes.
shot, right? It's not 100%, and I should not have to even repeat that. When I come out here on my show, I shouldn't have to repeat that to somebody and say, you know what, you get the flu shot because it helps reduce the symptoms if you do get the flu. Same with the vaccines that we have now for whatever, for this coronavirus.
Mm.
You know, it does help reduce the symptoms, and yeah, still people end up in the hospital too.
See, I'm also facing like you. Just I'm feeling like runny nose and scratchy throat and headaches and body pains are there. But I was been fearing just I want to if I want to go to hospital, what their doctors will say is it's positive or negative. That's the fear I will getting that. I'm sure not about that, but it's totally my health is okay present. If the COVID symptoms will be there, how the situation will be means the person who how will be affected. They will be able to stable or they will become more illness.
I don't know. I don't know. I mean, even you've got like the same symptoms that I have.
Uh-huh.
And I'm in the house with two people who tested positive,
Uh-huh.
right? So, I can say, yeah, I have COVID. You know,
Yes,
so
yes.
I will
I think
find out. I will find out probably no later than tomorrow when the PCR
uh,
test comes back.
your family members get PCR test. Just
Just my oldest brother and myself, because we're essential caregivers,
mm-hmm.
right? We're eligible for that. Any like I said, anybody who doesn't work in the healthcare, they don't
Uh-huh.
work at if they don't work at retirement homes or nursing homes.
Mm.
If you're not if you're not an essential caregiver, you can't get a PCR test. You can do the rapid test.
Uh-huh.
You can get the rapid test kit and you can do the rapid test. It's not
Mm.
100%, but at least it's gonna, either give you a, a positive test, or it's just gonna just be negative. But take it with a grain of salt of the symptoms that you have. If you have, 3 to 5 symptoms, then take it that you have COVID.
Trucker, just 1 second. Just I have some work. Then I'll return back to your show. Okay, trucker.
Yeah, no problem.
Within
Yeah.
five
So,
minutes, I'll be
anyways,
back.
sure, no
Thank you.
problem. Yes. Yeah, you're welcome. So, anyways, with the government, making it more accessible for teachers and like that to get vaccinated. These vaccines have been here for a while now, and you've had plenty of time. You've had plenty of time to get vaccinated. And when I was talking about the the conservative leader Aaron O'Toole, calling on the government to accommodate the unvaccinated, we have accommodated you enough. Like I said, if you're still sitting on the fence, wondering if you should get vaccinated, well, we've had plenty of time. We're not going to accommodate you any more than we already have. And you know what? For the anti-vaxxers, well, they're just a waste of time. It's absolutely ridiculous. For the population of Canada, 38 million people live here in Canada, and we're only sitting at 82%. That's ridiculous for this population. The more the you know the majority of people ending up in hospital are the unvaccinated, people who have a single dose, and there are people who are vaccinated who are ending up in hospital. Now I can't say why that would be. It could be a number of factors. They could also have underlying health conditions. The government of Ontario about a month ago said that closing down businesses and closing schools and everything like that is not the answer. And he does like a complete 180, you know. So the gyms are closed, the movie theater are closed. The indoor dining is closed. No fans in the stands. The things that I said, like the shopping malls can stay open, obviously. The other non-essential businesses can stay open with capacity limits. Like he didn't turn around and say, okay, we're just going to close all non-essential businesses and stuff like that. At least he stuck to that. But even in the cinema business, you know, something like 6,000 people in that industry is out of a job until they're reopened. Now, when you look at the health and fitness, how many gyms are in this province, and how many gyms are in every city, and think about all their staff that they employ. They're probably on the upwards of about 10,000 people who are out of a job until the gyms can reopen again. And restaurants, when it comes to the restaurants too, right? How many employees are there? All the servers. Well, they're not there now because we don't have any. You can't dine in a restaurant right now. Hours are being cut back in some places. And then we're facing the shortages. I was reading an article earlier. When it comes to the homeless shelters, they're looking for volunteers and they're looking for people to come work for them because they're short of staff because they're off sick. And we're seeing that all over the place. We're seeing it just about in every sector. The shortages of staff. Then you got the people that here's another one. So when I first got my two vaccines, I got Pfizer. On the 24th of December, just passed, I was eligible for a booster, and I got Moderna as the booster. Now what we're seeing is people who have gotten Pfizer as their to be fully vaccinated. They would cancel appointments because they found out they're getting Moderna, so now they're looking around where they're going to get Pfizer. Well, here's the rule. The rule here in Ontario is that children age of 5 to 17 are going to get the Pfizer. 18 and older are going to get the Moderna. So the people canceling their appointments because they found out they're going to get the booster and it's going to be the Moderna. If you think you're going to find any other clinic in this city or this province of Ontario that's going to give you a Pfizer shot for your booster, you're sadly mistaken. And if you don't like it, don't get the booster. That's the way it is here. I knew going in, when I was going in for my booster, even though I got Pfizer twice, I knew going in that I was getting the Moderna. And you know what? I didn't give a shit. Just give me the booster. People, you know what? Beggars can't be choosers. You know what I'm saying? You just can't. And that's the position that they're going to find themselves in, is that you are not going to get a Pfizer as a booster. You're going to get a Moderna shot for the booster. Period. So they can go online all they want, and they're going to find out because it's going to say when they book the appointment that they are going to get the Moderna for the booster. Like I say, beggars can't be choosers. Either get the booster or don't. That's entirely up to you. Consider yourself fully vaccinated if you have both shots. They want to do the booster for the elderly. They want to do the booster for people in retirement homes and nursing homes. And then they made it for people 50 and older to get the booster. That's when I became eligible to get it, right? And then they lowered it again. But when they lowered it again for the booster, that's when they said children 5 to the age of 17 will get the Pfizer, and 18 and up will get the Moderna as the booster. So they had more Pfizer for the younger people. And they can't say they never heard about it because it was all over the news. Doesn't matter, you picked it up on your phone, you're looking at the news on your phone, or whatever the case may be, sitting there watching the news on the television. They can't say they didn't know about it because it'd be full of shit. That's what's going on. So if you don't like it, like I said, don't get the booster because it's going to be Moderna. I don't know what else to tell you. I really don't. You know, everybody is barking at the government, whether it's provincial or whether it's federal. I mean, I don't know what what we can do here. I really don't. You know, they get their advice from their science table. from their top doctors. And then the premier and the health minister and the educational minister and the Ontario doctor got to come out and do a news conference, lay it on the line, let the chips fall where they may. Of course, it's not going to satisfy everybody. Doesn't matter what the government does anyways. It doesn't matter. It's not going to make everybody happy. I don't like this any better than anybody else does. The other day, a news report came out. I think it was on the 30th of December. A group of like there were celebrities, like important people, whatever, the high end people, rich people, I don't care. Apparently they won this trip to Cancun, Mexico, and so what happened was they were partying on the airplane. They were body surfing, they were drinking, they were smoking, they weren't wearing their masks. I mean, they're just acting like a bunch of children out of control. So they were to return Wednesday just passed, and the original airline that flew them there refused to fly them back. Air Canada refused to fly them back. There were all these people out of the province of Quebec. Air Canada refused to fly them back. Air Transat refused to fly them back. Only 27 people out of 130 have made their way back to Canada. And then, of course, held by the border personnel for questioning. The federal government, the people head of the aviation here in Canada, are all investigating this, and anybody found to be in violation of the aviation rules and being on an aircraft. Now, the organizer, the federal government and the airlines were talking to the organizer, and they said, we got stipulations here, and if you agree to all these stipulations, we'll fly them back. So the one out of 5 stipulations, the one that the organizer didn't agree to, is that they weren't going to be fed on the airplane to come back. So the organizer or promoter didn't agree to the other stipulations. It's a 5-hour flight, for Christ's sakes. I mean, are they going to starve to death in 5 hours? Oh, they're not going to be fed? Their behavior on that aircraft was ridiculous. They were jumping around up and down on the seats. They were body surfing. They were smoking. They were drinking. 30,000 feet up in the air, as though they think they're in a fucking bar. Over 30 of them so far have tested positive for COVID, and they now are isolating in another location in Cancun, Mexico. And only 27 of the 150 or whatever have made their way back. Now, all the airlines, want the manifest of all the names that were on that aircraft. So these people that can't get back or being denied a flight back to Canada are upset. Why the hell should you be upset because you're being denied a flight back to Canada? Well, you can stay down there. You keep your sorry ass down there. And however you get back here, that's your problem. Oh, and some people say, we didn't have, yes, we were on the plane, but we were sleeping. Got 175 people on this plane, freaking jumping around like children on a fucking trampoline, and partying, and you were sleeping? Seriously? I doubt that very much. Party on a plane. Unbelievable. Unbelievable. And the ones, and I mean, they are, going to find out who they are, and they can be fined $5,000 for each infraction, and they can also get jail time for their actions. I think your employer should just fire your ass too. I think that's what should happen to you as well for your behavior. The government throughout this pandemic, has an advisory out not to travel outside of the country. They really don't want you to travel inside the country. But the travel advisory has always been here. Something happens in another country, you're stuck there. The government is not going to help get you back. And this kind of behavior of these individuals on this aircraft now you can just stay there. They're going to have to find an American flight coming back. But, doesn't matter because once you arrive in Canada, you're going to be detained. And yeah, I mean, when when you're on because this was a big promotion of some sort. I don't know what it was. Excuse me, you had to be invited. I guess I don't know. So it was supposed to be, a round trip, so round airfare and everything, all inclusive. And like I said, now they find them in this predicament. Um, excuse me, 3 airlines are not coming to get you. And there'll be probably others that'll join in because they don't want that kind of behavior on the aircraft. Plain and simple. So I don't know if we're gonna connect here or not. So like I said, yeah, 27 people so far have made their way back, and there's still like 130 people who are now scrambling to to find the way back to Canada. So it's going to be a whole lot of people in a whole lot of trouble, and that's their own damn fault. Like the rest of us. Like the rest of us out here that are trying to do all the right things, follow the rules. And I'll tell you, man. I mean, we're a lot different than a lot of countries, and especially when it comes to the United States. Now, don't get me wrong. I like Americans. I do. Here across Canada, um, in the sporting events, and right now, I mean, it's hockey. There's no fans in the stands. They can have 1,000 people. They can, but they're not going to. Now, I'm watching a hockey game. I watched a couple of hockey games today, and they're being played in the United States, and the arenas are full 20,000, 25,000 people in the arenas. None of them wearing masks, nothing. There's a big difference here, right? You're pushing in the United States. You're pushing over 1 million cases a day
Yes,
of
of course.
Omicron. And you wonder why, and you wonder why, in across America, and you wonder why that your healthcare, your hospitals are under strain, as
Yes.
though you just don't give a shit about your healthcare workers, the people that work in the hospital. You must think that they're God or something, that you're just going to go in there, you're going to walk out healed. It was like Jesus Christ touched you on the forehead. It's absolutely ridiculous. I'm sorry about your liberties and freedoms. Like, holy shit. I mean, don't think we have that here in Canada? Of course we do. We're a democracy, just like other countries around the world. Not according to Americans. Oh, no, you do that. Oh, fuck, you fuck with their freedoms and liberties. Holy shit, look the fuck out. It's absolutely, I'm serious, man. It's absolutely ridiculous.
Same. Our government also same. Ridiculous.
It's absolutely ridiculous. I'm saying Canada's perfect. We're not perfect here. We're not. But we're certainly a hell of a lot more, I don't know, patriotic, I guess I could say that, than what Americans are.
Yes.
It's just in the Canadian blood that, the majority of us, and I can say the majority of us, are going to follow the rules, and the majority of us are going to get vaccinated.
See, me too also like Canada. Like comparing to US, I like more Canada peoples. They are very heartily, kind-hearted persons. Comparing to like US, they show some discriminations and racisms. The US people shows on people.
Mm-hmm.
Triggered, how you drink the water means you are drink cool water or warm water.
What? For what?
While consuming your water, just while you drink, how you drink the water means you drink water like cool or hot. Just normally, I'm saying normally.
Cold water.
Cold water.
Yeah,
Because,
of course.
I'm saying some remedies like do drinking like warm water. Why? Because your throat is you're suffering from some your throat problem. Just it gives some relief while you're drinking warm water. Just in Indian
Uh-huh.
people, so many people, so some people do like that. They will drink some warm water. If you get affected with some throat infection or some problems, they will add some salt in water.
Oh, I've heard of that. Yes, and they'll gargle with it. They won't like if you don't actually drink it, but you'll just gargle with it, salt and water. I've done that before. And
Uh,
stuff like that, and it kind of soothes it for a little bit, but you know,
Please don't do it like don't drink from now onwards like cold water. Please consume some hot warm water, because
yeah,
it gives some relief, and your body will also digest easily when you
yeah,
consume some.
yeah, probably even like room temperature too, right? If
Mhm.
you can if you get the water up to room temperature or something like that, it might be, probably a little bit, I guess make your throat feel a little bit better and stuff like that. But soon, I'm gonna have to end the show because my throat is getting really sore.
Yes, yes. Just I drop
So
my mom to my mom. Just I drop my mom to my aunt house. Just I go outside now. The how the cloudy is like minimum 22 degrees Celsius. The cloudy. If I step outside of the road, I feel so much cool, freezing. Just I can't tolerate. Just I think that I get the fever like that. Cold is like in India. So we can't
mhm,
tolerate the cold. See how we are
mhm,
feeling. Yes, it's a very dangerous temperature we are facing now. We never
yeah,
seen like this temperature. Only this we are facing in 2022. This is a very dangerous. I think this is a terrible year for us. Mm, we can't tolerate this cold.
mhm,
Can you give
yeah.
some precautions? How can we avoid the cold?
You send some cold air down to you.
Mm.
Send some cold air from Canada to cool you off down there.
And,
Yeah. Oh well. Yeah. I mean, it's not too bad. Like here in the province of Ontario, it hasn't been too cold. I think last night it went to -17.
whoa, it's a very dangerous. -17 means we can't imagine how it
So
looks
yeah,
like.
yeah, and then the temperature by tomorrow morning, Sunday or yeah Sunday morning, it's gonna
Mm.
be excuse me, like +2, +3 out, so it's gonna jump 20 degrees
Mm-hmm.
or more, right? So
If
from
get
going -17 down to the plus side, yeah, it's gonna come up to at least 19, 20 degrees
it
with
means you
rain.
are saying that so 1917 degrees. The road can be appears the road if you go outside the road will appears or not, like we can
Oh
see
yeah,
the road.
the roads are icy.
Uh-huh.
Yeah, yeah. Like the main roads are okay. Like the side streets are more snow covered and icy, but the main roads, like the big travel roads, they're all clear.
Mm-hmm.
But
Is
just the
Alaska is a
street
part
I
of
live on,
is Alaska
the
is
street
part
I
of
live on, it's all icy. Pardon?
yes. Is Alaska
Go
is a
ahead.
part of Canada or US? Is Alaska is a part of Canada or US? It's near to Canada, I think, right? Is being
Yeah, we have
situated
the
neighbors.
yeah we have the we're neighbors. We have the longest undefended border in the world.
Uh-huh.
I live if I took I live anywhere from 1 to 2 hours away from the United States.
Uh-huh. Is any
That's how.
visa is mandated if you travel to US? Like, do you want to take a visa for traveling to US? Visa is mandated
Well,
for
we'll need
Canadians.
yeah, well, a passport.
A passport.
Yeah, yeah, yeah. To cross the border, we need a passport.
I think is the second largest country in the world. I think Canada is the biggest country comparing to Russia. Then comes to
Canada's
Canada.
Canada. Canada is the second largest country in the world with the land mass.
Yes. What about the Greenland? Your Greenland is a part of your above your country, like uphead from your top of the country.
Mm,
Is a Greenland is a part of North America?
no, no,
Uh-huh.
no. We got Canada, U.S., and Mexico.
Canada, US, and Mexico. These are the part of North America.
Yes, or you
But
can call Mexico
when
South America, but yeah,
when I seen
yeah.
some
Canada,
maps,
United States. Yeah, the United States is right in the middle of is between Mexico and Canada.
yes, yes, of course, it's a middle part of the Canada and Mexico. When I seen in some maps, geographical maps, uh, the Greenland is situated top of the Canada. There's some islands are there. Just I thought that and Greenland is also part of North America.
No, no, Greenland isn't.
I think is near to
No,
you.
they're still
If you want to
far.
travel
They're
Greenland,
far enough. No,
it's
well,
far enough.
they're still far enough. They're still far enough. Yeah, they're far enough away.
Uh-huh.
Yeah,
I think it's
yeah,
near to.
by ship or plane. Yeah, by ship
Mm,
or plane. But yeah, Greenland. They're still. It's still quite a ways away.
mhm. Yes, I got an idea that you said that Greenland is not part of North America. I got it. I got it.
Yeah,
Yes, I
no,
got a
no.
clarity.
Yeah. So I think, if I were to fly from here, like in Ontario, if I were to fly to Britain or like London, England, I think it's something like a 10-hour flight.
Hmm. I think in Canada,
Greenland will probably be about 8 hours.
yes, official language is French. I don't know that. Is really the French is the official language for Canadian?
French and English.
French in English. Uh-huh.
Yes, yes, is the official
Most of the
language.
Canadians speaks French. Means most of the Canadians
M-
speaks English or means French or
Majority,
English.
yeah, yeah, a majority of Canadians, we speak English. So let's see, Quebec, obviously, a lot of French speaking. Out on the eastern seaboard, like St. John's, Newfoundland, all this like that. There's French speaking people there. Even here in Ontario,
Mm.
like in the northern parts of Ontario, French speaking people, but majority of us speak English.
Uh-huh.
Yeah,
I think do you speak French?
no,
I think French is very tough language to learn. If you want to
I,
learn tough, it's a very
yeah,
tough, difficult.
yeah, yeah. I never grasped it. I don't know. I just never grasped it. Maybe just because I just wasn't interested. You know, just because I'm Canadian, I don't have to speak French. So I've been to Quebec plenty of times, and there's English speaking people in Quebec too. They just choose not to speak English. They just rather speak the French, and that's fine. So
The last question, Raga, this your country is like the second language is French. Coming to the French citizens, some of the French citizens are there. They want to travel to Canada. There is a visa. There is a particular visa free entry for them. Like they should be stamp the visa. Just they go to consulate and they have to be stamped there. There is no free entry for them in your country.
I don't think so. If I mean, are you meaning that if they want to come and live in Canada?
No, no, no. Just traveling purpose only for travel. If some citizens are there, like in French people, they want to travel to Canada. There is a
Yeah.
visa free entry for them.
Well, I just
For
for anybody who wants to travel to Canada, you have to have a passport.
Mm.
That's what you have to have.
And
You know,
not like that. when the French colonialism was started in Canada, like I'm saying like that, the other the official language is Canada, like you're in French. The French people is some restrictions will be there for to visit Canada. Is there any restrictions for them? There doesn't have any
No,
restriction.
no,
Uh-huh.
no, wouldn't be any. No.
Mhm. Means visa must be mandatory.
Well, visas are used for different things. I mean, if you want a student visa or you want a work visa, you know,
Mm.
that sort of thing. But if you're just coming here to visit, you just need a passport.
Mm.
You don't need a visa. I mean, maybe some people carry visas. I don't know for whatever, but generally, to come here to visit or whatever like that is you need a traveling visa or a passport.
Mm. But Indians will get tough
So,
to get visa for Canada and US. Why? Because they ask a lot of questions in a consulate. What the purpose of travel? Why you're visiting? They like the typical questions they will raise from that. So
well,
many
yeah, it depend. Yeah, yeah.
so many.
It's like anything. It's like anybody coming from, whether they're coming from the United States, whether they're coming from Europe or wherever they're coming from. Yeah, I mean, you can be stopped at the Canada customs borders and you can be questioned.
Hmm.
Not just because you're from India, or anywhere, the Middle East or like that, or because you're black, or they're not gonna single you out because of who you are. It doesn't matter. I mean, I've being a trucker, I've got, like, when I used to cross the border driving transport. Then I'd be selected to go through X-ray. Then I'd be selected to go into customs. And then they're gonna question me.
Hmm.
It's like anything. It's like anything else, right? It doesn't matter.
Yes, of course.
So,
Do you travel?
but I
Uh,
kind of, I mean, there are at times where it might get to the point that this is just a racial thing. Because I'm from India or I'm from the Middle East. Because I'm black, or whatever the case may be. And in some cases, they're right. That it is a racial thing. That they are centering you out because you're from India. But that happens anywhere you travel. It doesn't matter. I'm just starting to lose you now.
Hmm. I think you love travel. Like,
I didn't quite get that. They have a little bit of an echo.
mm,
So, ladies and gentlemen, I gotta get myself some water and hopefully put this fire out of my throat here. So I'm going to end the show this evening. Because, like I said, I don't
okay,
I don't
thank
want
you.
to go into
Thank
a
you, Drakkar.
yeah I don't want to yeah thank you. I don't want to go into a coughing spell here because that's coming. So and I don't think anybody here sitting on the show here is like that. Sitting there listening to me hack up a lung because yeah I can really start to feel the cough coming on here. So, anyways, ladies and gentlemen, I want to thank you for taking the time out here to listen to the Truckers Podcast, and the gentleman calling in from India. Thank you for coming on the show and calling in and talk to me. And hopefully, I'm feeling a little bit better tomorrow, and hopefully, I can get out here and of hopefully I can too, because had not just trying to get out here and trying to talk to you and stuff like that. With the weather we've had come through here and the internet going out, and it's not been fun. Since I've been home from work, anyways, there's been no better place I wanted to be was to be coming out here and talking to you. And then having all kinds of interruptions and not be able to get the show up and going. But the internet seems to be working fine right now, so hopefully um, keep that going. And so I wanted to go off air now before, like I say, before I go into a coughing spell here. Um, but thanks for coming out here and listening to the Truckers Podcast. And have yourself a great evening, a great day or afternoon, or whatever time it is where you are listening um, around the world. And have a good night, ladies and gentlemen. This is the Truckers Podcast. I'm your host, Doug from Ontario, Canada. Take care, and thank you.